My sincere thanks to the Society for Women's Health Research for honoring me with the 2023 Health Education Visionary Award. I'm deeply humbled by this award and grateful to you for all of your support in this area of research. I'd also like to congratulate the other award winners. I celebrate with you. I was fortunate to work with the Society for Women's Health Research as co-chair of the Interdisciplinary Network of Alzheimer's Disease. Through that effort, we were able to publish a call for action that's been highly cited. It advocates for more dollars and more awareness of women in Alzheimer's disease. I began my work in 2010 with the Society, advocating for more work in Alzheimer's disease in women. You know, we knew since 1999 that biological sex plays a role in Alzheimer's disease. We knew this because the most common genetic risk factor for Alzheimer's disease is a greater risk factor for women compared to men. Since that time, there have been many more discoveries in sex differences in Alzheimer's disease. Those discoveries not only benefit women, but also benefit men. To illustrate this, I would use some of our own work. My work with Erin Sunderman, my former PhD student and now colleague, demonstrated the importance of considering biological sex differences when diagnosing Alzheimer's disease. The way that we diagnose Alzheimer's disease is by giving people memory tests, most commonly a list of grocery items that they need to learn and remember for later. Turns out that lifelong, women show an advantage in this ability compared to men, yet the norms for determining whether somebody's impaired on this test didn't take that sex difference into consideration. We discovered that when you do, you more accurately diagnose Alzheimer's disease in both men and women. So 10% of women in whom Alzheimer's disease was missed can be diagnosed, and conversely, 10% of men who were told that they had Alzheimer's disease were found that they actually didn't have Alzheimer's disease. They were just performing in the low normal part of the distribution of scores on that test. So this illustrates the importance of pursuing sex difference research for women and men. I'd like to express my gratitude for the people who've been so instrumental in helping me along the way. Susan Resnick for her mentorship at the National Institute on Aging, where I began this work. And she and I discovered in 2000 that estrogen actually promotes the function of memory circuits in the brain and promotes memory functioning. When I transitioned to the University of Illinois at Chicago in 2002, I was grateful to Stacy Geller for her sponsorship in welcoming me into the UIC community, which has been my home for more than 20 years. I also would like to thank Dr. Tom Clarkson. The late Tom Clarkson was instrumental in sponsoring me to the North American Menopause Society, my home for menopause work. When you educate the public about women's health, it's important that you use evidence-based material in doing so. You want to weight the quality of the evidence, whether that evidence is based on randomized clinical trials, whether sample sizes are large. In their many position statements and outreach efforts, NAMS takes this high standard very seriously and includes that in their position statements. It's a benchmark for all of us to follow. NAMS, thank you. To disseminate this information on women's brain health globally, I'd like to express my deep gratitude to the International Menopause Society. Just last year on World Menopause Day, my colleague Nicole Jaff and I published a white paper on brain fog and menopause that was translated into more than 9 languages and distributed globally to inform women everywhere about how they can optimize their brain health at midlife and beyond. And then finally, I'd like to thank my family and friends for their support of my career over the years. I'm grateful to you. Many thanks again to the Society, and I'd like to use this opportunity for a call for action to get women the help that they need at menopause and beyond. We need to train more healthcare providers in menopause care so that this universal experience of menopause is dealt with in an informed, evidence-based way. There's much more we can do to help women, and I'm grateful to have the opportunity to do my part. Thank you.